My urologist appointment went rather well today. And this doctor took me seriously, and which I was really surprised, because a lot of doctors and other urologists and stuff that I've been to are really kind of nasty. It's like they're looking at you, judging you, and basically asking you to prove yourself. Like before, I've always felt, when I see these urologists, like I have to prove that I'm in testicle pain, and I have to prove that I'm transgender, which, like I have explained many times to many different doctors and other people, the complicated nature of my situation, that the pain is the real reason I'm having my testicles removed, but then there's the transgender related reasons, the gender dysphoria. So I will feel a lot better in both regards. So I talked to this urologist for about 20 minutes, and he has experience doing orchiectomy. He's done them a lot, and so we talked about various things, the cost, insurance, anesthesia, whether I'll be put to sleep or whether I'll just have local anesthesia, be awake through the whole thing. And so we just discussed various aspects of it, and this is the kind of thing where it's awkward stuff to talk about. So he was asking me about what I wanted done with the scrotum. Because, see, some people, they want to keep their scrotum because they're planning on having it reconstructed into an artificial vagina later. People who do sexual reassignment surgery. And I told them, no, I'm not doing that. So, we can remove the scrotum is what I would prefer, because I don't need to have it hanging there, So it's an awkward talk, talking with the urologist about, the testicles and the scrotum and all that. But even though I'm still not really comfortable with talking about my private parts with anybody, the thing is, I had to tell my story so many times to so many different doctors. I've been to primary doctors. I've been to the psychologist, who is really nice, actually. I've been to different urologists. I've had a few visits to the emergency room. I've had several problems related to my testicles over the past 2 years. And finally, I had a meeting with a urologist who actually listened to me and is willing to do the surgery. So we have my surgery scheduled on September 17th. And I'm going to be required to do a COVID-19 test on September 15th, and then isolate for 48 hours. So what this means is I'll just have to save my vacation hours, and then I'm going to have to request probably a week off of work so that I can isolate. I can do the COVID test and isolate for 2 days before the surgery, and then recover after the surgery. And then after that, I will be no longer in pain. I'll be able to work my job better. I'll start up my dance lessons again, and everything will be just fine, because my life as it stands now is actually pretty close to perfect. I have this apartment, I have this job, I pay my bills, I know who I am, I know what I want. So most things in my life are going rather well. So basically the testicle pain, and what I've been going through with that, is like the only real problem I'm struggling with right now, So soon that will be over, and then I'll just have, I can see my main doctor, and I have other resources if I want to find out about hormone therapy. And it's going to be a thing where, if I need hormones or not. That's kind of how I'm looking at it, because the only reason that I really would necessarily need hormone replacement therapy is if I started, like losing bone mass or anything like that. Because if your hormone levels are too low, you can have bone loss, sometimes muscle loss, that sort of thing. So everyone needs to get their hormones balanced anyway. And I already have a reference frame of my hormones from my previous blood test. So I know what my hormone levels are like now, and then I can just manage hormones through medical care the rest of my life as needed, which is something anyone should do whether or not they have their testicles or not. So everything went really well. I think this is a nice doctor, and hopefully I'll have my surgery soon, and that will be the end of it. And I can get back on to focusing on the other aspects of my life that have been put off. I stopped dance lessons. I haven't been able to concentrate on my computer programming. Work is hard because I'm in pain, and there's a lot of adjustments anyway with the mask requirement and everybody freaking out about COVID-19. So yeah, life has just been crazy lately, but it's possible things will be improving. So after September, I will no longer have my balls, and then I'll just see where life takes me from there. Hopefully everything will continue to go well. So that's what I wanted to say for now, because I know some people who know me are probably wondering, how my doctor visit went and if I'm going to have surgery. So it's good news.